The process of exchanging gases between the atmosphere and the body's cells is called respiration and involves several events, including breathing. As we zoom into the body, we can observe the respiratory system during gas exchange. Air passes through the alveolar sacs to the alveoli, where gas exchange occurs. In this cutaway view of an alveolar sac and its capillary bed, the process of gas exchange is easily observed. During inspiration, atmosphere air fills the alveoli and gas exchange occurs between the alveolar and capillary epithelia. Oxygen in inspired air is represented as a white gas. Carbon dioxide in expired air is represented as a blue gas. Notice the change in color in the red blood cells during gas exchange. Now let's zoom into a higher magnification view of gas exchange at the respiratory membrane. Red blood cells in the capillary adjacent to the alveolus release carbon dioxide and bind oxygen.
The body's breathing apparatus is enclosed in an expansile bony cage, formed by the ribs, the spinal column, and the sternum. The floor of the cage is closed by the muscular diaphragm. Air passes down the windpipe or trachea to enter the lungs. During inspiration or inhaling, the diaphragm moves downward and becomes flatter, and the rib cage expands. This creates a partial vacuum in the lungs, and to equalize the pressure, air is drawn in. Expiration or exhaling is passive. The lungs have elastic tissue in their walls, and during inspiration this is stretched. In expiration, its natural recoil causes the lungs to partially deflate.
You're smart, 'cause I'm taken by you, taking me apart. I could best believe I died to live, for the hour dictates the need, and I am speaking.
What happened to the patient? Smoking decreases the levels of oxygen reaching tissues,
giving rise to different health problems such as stroke, heart attack, or miscarriage. It increases cholesterol levels in the blood, increasing the risk of heart attack.
So you were saying that the patient has chronic obstructive pulmonary disease?
Chronic obstructive pulmonary disease or COPD is a group of health conditions which blocks airflow and causes difficulty in breathing. It causes health problems such as emphysema and chronic bronchitis. Emphysema is breathlessness that is caused by damage to alveoli or air sacs. Chronic bronchitis causes frequent coughing with a lot of mucus. Smoking is responsible for about 80% of COPD cases. Smoking increases the rate of decline in the lung function 3 times the usual rate. Breathlessness starts due to decrease in lung function. I am advising the patient to stop smoking.
Thank you. Mister, the doctor said you have COPD. She is advising you to stop smoking because it is bad for your health.
Thank you for helping me.
Welcome. Glad to help people that are in need.
Sigarilyo. Ito ay isang produkto ng ating bayan na malaki nga ang taxes, pero malaki rin ang pinsala na naibibigay sa mga taong gumagamit nito. Una, yung paninigarilyo, ang malimit naming pagkagalit ng mag-asawa, lalo na nung kami bata-bata pa. Talagang ayoko nang siya ay maninigarilyo. Kasi nga, ay masama ang amoy ng usok. At ang isa pa, ay yung kumakapit sa mga damit. Kahit hindi ka mang naninigarilyo, pagka naamoy mo ang usok, na anuhan ka ng usok, na anuhan ang iyong damit ng usok, ang iyong buhok, ito ay madadala mo ang amoy. Kaya ayaw ko na makakaamoy ng sigarilyo. Ay ano pa nga ba yung paninigarilyo ay masama sa katawan ng isang tao. Dahil ito ang malimit na pagsimulan ng mga sakit sa ating baga. Dahil hindi namamalayan ng taong naninigarilyo na ang kanyang baga ay unti-unting nauubos habang tumatagal ang paninigarilyo.